Dr. Quinn, when I hear happy pills, you must be happy, but I don't think that's the case with this.
Well, I'm actually smiling right now because this is a happy segment. The deal is, I actually had a patient about maybe 2 weeks ago, and she came in. She was from another state. She was a brand new patient. And when I walked in the room, the first thing she said was, I need a refill on my happy pills. And I was a little confused. I was like, okay, let's talk about now. Did these happy pills have a name? And she gave me the name of Zoloft. And I told her that's something we can definitely do, but we need a little more history. And we did have her notes from her last physician, but I said, I want to go over these notes with you to make sure that these are the right medications for you and your condition.
Why do they call them happy pills?
Well, the reason she told me she called them happy pills, and I've heard that before, but I just wanted to make sure because I've heard some other pills being called happy pills too.
Yeah, exactly. You know, you don't want to get confused with something that may be illegal.
Exactly. Because some of these pills, you don't need Dr. Quinn. You can maybe purchase them behind the Rancheteria on another street. But the deal is, these particular pills or this medication that she was requesting is a group of medications that's used for either depression or mild anxiety. They're called serotonin reuptake inhibitors. And basically what these medications do is they help you get a higher level of a neuropeptide in your brain called serotonin. Your brain makes serotonin, your brain destroys serotonin, and you keep a certain level. And when you take these medications, it brings your level up. And it's been shown through research that individuals that suffer from mild depression or mild anxiety, and some have both, they typically can have a lower level of serotonin. But what the research has shown is you can bring the serotonin up, then they have less depression, less anxiety, and they're typically happier. So this is something that we want to let everybody know about these happy pills, because there are a lot of people out there that might be suffering. They might have mild depression, mild anxiety, not getting treatment. Well, the deal is treatment is just a doctor's visit away.
How do you know if you need to have them? Because I think some people think that they need to have them, but they really don't, or people think they're fine, but maybe it's going to help your life a lot. So is there any kind of thing you could say at home, like, hey, I'm feeling this way, maybe I do need to go check?
Right. Well, typically, we advise everybody to go see your medical doctor at least once a year if you don't have any chronic medical problems. And during the doctor's visit, we'll ask certain questions that can cue us to ask more questions if needed to try to solicit that diagnosis if we suspect you have it. But also, we want to use programming like this, which is so valuable on WJTV, the most brilliant station in the world, to let the general public know. So for the general public, if you're someone out there in the community, and maybe you feel a little sad sometimes, you used to be happy, but you just feel a little bit blue, and you don't know why. Or maybe you just feel tired. You used to have all this energy, but your energy is down. Maybe you can't concentrate. You're having problems at work. You don't want to go anywhere. You used to go to church or choir practice or the movies or go dancing with your husband or whatever, but you just don't want to go anywhere. You might be suffering from mild depression or mild anxiety, and it's a good idea to have a conversation with your medical provider. And that way they can ask more questions. If it's determined that this medicine would benefit you, you can get the prescription, and then some of these problems you're having can be no more.